Hi everyone, my name is Kathleen McDonough. I'm a family physician and also board certified in addiction medicine. I'm excited to be here today to speak to all of you about my work at a community health center serving the west side of Chicago. So, a little bit of background about me and why I chose underserved medicine as a career path. I grew up in the northwest suburbs of Chicago and attended the University of Notre Dame for undergraduate, where I majored in anthropology and pre-med. I then went on to Loyola Stritch School of Medicine to obtain my medical degree. And it was really here that I fell in love with family medicine, primarily because I felt this specialty was where I could make the most impact. I loved the idea of caring for entire families throughout their lifespan. And I always knew that I wanted to focus on urban underserved medicine. So completing my training at West Suburban Family Medicine residency program seemed like the most natural next step for me. So West Suburban Hospital is located on the border of Oak Park and the Austin neighborhood of Chicago. It primarily serves patients living on the west side of Chicago and historically has been a very medically underserved area of Chicago. During my residency, I was able to work at a federally qualified health center, or FQHC, called PCC Community Wellness Center. And it was really here where I was truly exposed and became enamored with community medicine and the concept of integrated team-based care. So I took a full-time job at PCC after completing my residency, and 12 years later, I'm still here and now the medical director of our outpatient addiction medicine program. So I'll delve into my passion for addiction medicine in a second, but what I love in general about working at a community health center is the unique opportunity to provide wraparound services using an integrated team-based care model. Due to unique funding and reimbursement opportunities, we as healthcare providers working in a community health center setting have an incredible opportunity to address not only the patient's needs, but also the needs of the community as well. We do this by implementing disease prevention programs, advocating for health promoting policies, and of course, diagnosing and treating diseases using an interdisciplinary team. I think this idea will become more clear as I talk about the creation of our addiction medicine program here at PCC. So some of you by now have listened to Amanda Brooks' video. She was a licensed clinical social worker at PCC for 8.5 years and later went on to be our Chief Population Health Officer. But most importantly, she was my partner in crime in creating our chemical dependency clinic, or as we fondly refer to it as the CDC, which is obviously quite confusing during these pandemic times. So if this alone doesn't highlight how important and incredible the integrated care model is, I'm not sure what else will. So as some of you may know, the second wave of the opioid epidemic began in 2010. And this really was when we started seeing a rapid increase in overdose deaths involving heroin. What some of you who aren't from Chicago may not know is that the Austin neighborhood where West Suburban Hospital and PCC is located is really at the epicenter of the opioid crisis here in Chicago. So it was in 2011 that several of us at PCC recognized the need to start addressing the opioid epidemic that was affecting our patient population. And quite honestly, it was our patients that were actually coming to us begging for help. And I remember at that moment kind of reflecting on how important it is to treat the whole person. So we were there treating the COPD and asthma exacerbations, but forgetting to treat the underlying disease that was causing these frequent flare-ups, i.e. heroin. So to take this idea of treating the whole person one step further, when developing our addiction medicine program, we knew right off the bat that just providing the medication alone would not be enough. Our addiction medicine program was founded on this concept of integrated team-based care. Addiction is such a complex disease, and providing medication is only a small part of effectively addressing the disease. With the support of organizational leadership, behavioral health, and the medical providers, we were able to create the addiction medicine program that exists today at PCC. So what is that program? As I mentioned earlier, it's a multidisciplinary, team-based care model focusing on addressing not only the disease itself, but also addressing those barriers to effectively addressing and treating the disease. We know the frequency at which mental illness and substance use go hand in hand, so our program would be wholly ineffective without the robust behavioral health programming. As a prescriber, I truly believe the behavioral health component of our program is equally, if not more, important than the medication I prescribe. Our model boasts a 1-to-1 ratio of medical provider to behavioral health consultant. So when patients come in for their medication refill, the expectation is that a behavioral health integrated visit will also occur. So depending on that patient's needs for the day, this could be a quick check-in or it could be a full 30-minute counseling session. Pre-COVID, we also offered many support groups. Some of these were co-led by a medical provider and a behavioral health consultant and included meditation, yoga, or acupuncture. I actually led a group with our director of behavioral health, and I did ear acupuncture while she led the patients in meditation. And then the second half of that group really focused on, the treatment and the barriers to abstinence and focusing on recovery moving forward. Other groups were led by the behavioral health consultant alone, and some of these groups targeted specific patient groups, like there was a men's only group, a dual diagnosis group. So we're really hoping to get back to those groups, and our patients really have expressed how much they've missed those groups during COVID, and those groups in and of themselves provide this component of support. Being able to share their experiences and their barriers with other people in recovery is really powerful. So while we all recognize the importance of behavioral health, we also recognize that it wasn't a one-size-fits-all model at PCC. We really wanted to create a menu of options so that treatment plans could be tailored to each individual patient. And when a higher level of care is needed, we've been able to develop strong community partnerships, so we're able to refer to intensive outpatient programming or inpatient treatment with ease. So I'd be remiss if I didn't mention the other members of our interdisciplinary team. Besides co-occurring mental illness, we know our patients may have many other barriers that impact their ability to access care or consistently engage in care. This is where our other team members come into play. As I mentioned before, early on we recognized it was just as important to address these barriers to treating the disease as it was treating the disease itself. Our patient population frequently struggles with unreliable transportation, housing and food insecurity, unemployment, criminal backgrounds impacting future employment, etc. And so in order to address these barriers, we recognized that we needed even more support for our patients. And from that recognition, we built an entire care coordination team. And this team consists of nurses, social workers, gap year students who are hoping to go to medical school or other, master's level or advanced degrees, as well as peer support specialists and peer doulas. So awesome. And that's specifically for our pregnant and parenting patient population. We've been able to partner with employment specialists who work with patients who have a criminal background, as well as work with housing advocacy agencies for those patients that might be living in unsuitable conditions or facing eviction. So all of this is to address those social determinants of health and build the foundation for a successful recovery. I definitely could not do my job effectively without our multidisciplinary team, and I know our patients are grateful for the wraparound services provided to them. So I hope over the past 10 minutes or so, my passion for addiction medicine and integrated care has become obvious. I encourage all of you to explore the world of addiction medicine, substance use treatment. It truly is the most rewarding part of my job. It's not all rainbows and unicorns, as one would suspect, but the positives far exceed any perceived negatives. It's such a privilege to participate in my patients' recovery process as they navigate rebuilding relationships, celebrating days, weeks, months of abstinence. It really is an honor to be there alongside that. And we know that the opioid epidemic, unfortunately, isn't going anywhere anytime soon, but we are in this unique position where we're able to make a difference in each of these patients' lives. So thank you so much for allowing me this time today. If you have any questions or interested in hearing more, please feel free to outreach me by email. My email address is kmcdonough@pccwellness.org. Hope you guys have a wonderful rest of your day and hope to see you in the community health world soon.